leadership at Park Nicollet recognizes that the healthcare home is the infrastructure for clinical quality. There is no better structure to deliver on the triple aim, which of course is about improving quality, affordability, all wrapped up in a great experience. When you take a model like the healthcare home, in essence you are taking a team of caregivers. You're taking clinicians, nurses, frontline staff, care coordinators, social workers, the whole team, and putting the patient and their family at the center. It's only then, when we bring all these skills together, that we can truly deliver on that experience that we come to expect and promise at Park Nicollet.
The healthcare home establishes connections with community partners and collaborators on care improvement projects.
We are in the process of developing several community partnerships that are really exciting. We've been working with Children's Dental Services, which already provides dental care to many of the low-income children in Minneapolis. And we are hoping that they'll be able to come and provide care at our office, but if not, we are working more closely with them to make sure that our kids get there and we get a report back saying they've been there. We are talking with the Washburn Center for Children about collaborating on mental health. Again, we'd love to have a mental health provider in our clinic. Don't know if that will be possible yet. We've done some really fun things. I'm working on a grant for Somali early brain development to try to improve the way that we screen for developmental delay in early childhood in that specific population. And with that, we've worked with the Science Museum. We took a field trip to the Science Museum with several parents. It was a lot of fun. So we are always looking for ways into the community to improve child's health.
The team approach to patient care boosts staff camaraderie and interaction.
I think that to expect a quick fix is unrealistic. I don't think we will see quick results. I think that it will take years to see cost savings and years to see the true effects on quality, but I think that the healthcare home redesign has the potential to revolutionize the way we deliver primary care.
The healthcare home makes the best use of the skills of each member of the care team.
I know that the team-based care is where the future is. I think that, I can practice medicine, but I'm not very good at making sure that the family is living as full life as they want to live. And Jamie does that, and I'm just a piece of it. In some studies, I'm 10% of the outcome has to do with me prescribing the right medicine. All the rest is how they learn to live their lives in spite of having a chronic condition. And most families, they don't want to come to see me. They want things done outside of the clinic. And with chronic conditions, most of the time we can do that. So I knew that I was a piece of the answer, but I'm not the answer for somebody with a chronic condition. I'm just a piece of it.
The healthcare home removes barriers to care of underserved populations.
So it makes me proud to be part of Park Nicollet, to know that we're able to address the needs of people with special needs or barriers to care, and as part of our business plan. I really like that.
The relationships formed in the healthcare home improve patient confidence in their care.
One lady in particular who provided me feedback is just a sweet lady. She's very independent. She's in her 80s and she's from the farm country, and she prides herself on her independence. And one time, and actually she has a lot of complications, but she usually manages them very well. But one time I advised her to go to the hospital because she sounded like she was having problems with her congestive heart failure. And she called me afterwards and she said, I told Dr. McCoy I didn't think that I needed you, but now I realize I need you. And I thought that was really special. And we have a great relationship.
I have more confidence that things are going to be done correctly and in a timely manner, and that things are not going to be missed. That I see 5 different medical personnel in 5 different locations, and I don't have to start all over again saying, just repeating all the conditions and everything. So I think I have confidence that my care is going to be even better than it was before.
The shift to a healthcare home model takes time, but it is worth it in the long run.
I would say I think it's incredible what the power of healthcare home and what it can do for our patients as well as our staff. If you've ever felt that, if we could only do a little more for this patient, or if we could only have additional resources, this is your time to be able to get that. And I think you just need to go for it. Yes, there are logistical things that you need to put in place, and there's processes you need to put in place, but that will happen. It'll all fall into place. You just need to go for it.
The new model encourages staff to work at the top of their abilities.
I think the most rewarding part is actually shifting into the team. I have relationships with all of my other care providers, other members of the team that have different skills than I do. I think it's a great recognition of what physician training is and our skills. And there are certainly things that only a physician can do, but having all members of the team working up to the top of their licenses and abilities really allows us to diversify and provide a more comprehensive care for our patients.
I think the greatest thing about Park Nicollet is when you walk in the door, we know you. We know who your family is. When we know your health situation, you don't have to keep telling us. And we've already, we already know. So it's good. We really care about our patients here. That's why I work here, because that's why I went into healthcare, because I want to do that.
Patients in Park Nicollet Healthcare Home Clinics say they would never want to go back to a traditional one.
There's no doubt that I've got 100% faith in my doctor. I mean, there's not ever a question about that. But this other layer of this care coordinator just kind of gives you the opportunity to be able to pick up the phone, ask some basic questions, and get an answer within a very short period of time. And they've been so helpful, and they really have made my transition through this medication issue really go so smoothly. I'm sure that I could have walked this path on my own, but now that I've got the care coordinator, I'm not ever leaving this clinic. I just think that this is it for me. I really feel like I've got an extra umbrella over myself in a rainstorm, so I think this is actually a great path.